Okay, now we're going to talk about intermittent bladder irrigation. So what are some reasons for this is that the patient has no or lower than expected urinary output in a urinary catheter drainage bag. The patient has increasing clots or sediment in the catheter tubing bag. Any recent 24 to 48 hour post-op urology patient not on continuous bladder irrigation. A physician's order is necessary to perform this procedure. So if you are noticing, oh, my Foley's not putting out what it should, it's great that you want to do hand irrigation. You just have to make sure you call the doctor and get an order. So the supplies are going to be this irrigation tray with the 60 cc Toomey syringe, clean gloves, catch basin. I like to use the really big basin, sterile normal saline, alcohol wipes, and chucks. So you are going to, let me just grab alcohol wipes. You are definitely going to want to put a chuck under here. Like I said, you're going to kind of make a mess. All right, so you're going to obviously check the order. So if you have a patient that already has CBI running, great. There is an order. There's actually a standing order that you can hand irrigate as needed. However, if the patient has just a regular catheter, does not have a three-way, then you can still hand irrigate. You're just gonna have to break this little red seal and you're gonna disconnect. You're gonna make sure this stays sterile. You could stick this into an alcohol wipe because that's obviously the catheter, the tubing, and you want that to stay sterile. This you're gonna be holding on to. Obviously, if you have to set it down, you wanna just make sure it's not touching anything dirty. Ideally, like if it's hanging over the edge, that's good. And obviously that's the port to blow up the balloon. So, and that is a separate order. It's not obviously you would have to get an order for that. But we're gonna use the CBI one, the three-way. So you're gonna get your equipment, explain the procedure to the patient, wash your hands, comfortable position. Yet again, you wanna make sure you palpate the bladder. You could do a quick bladder scan just to see how much is in there. That way, as you are getting rid of the clot and you see urine coming out, you can say, okay, well, yeah, there was 600 cc's in there, now there's 600 cc's coming out. But bladder scanning you can always do. You do not need a doctor's order. You also want to make sure that it does say that you should have a 22 French catheter, and anything that's smaller than that really is not ideal. It should at least be a 22. So you are going to have, this is a bedside table. I don't have one here, but pretend this is like a small bedside table. And you are going to open the normal saline. You're going to open this kit, which I've already done. You're going to make sure this stays sterile, the tip and the hole inside of this is sterile. So you can go ahead and you can pour your saline into the canister. And then you are going to wash your hands. You're going to put your gloves on. I already put the chucks under him. And you are going to get this ready. So this is to kind of catch all of that, whatever's coming out. This, the saline obviously mixed with the urine. So you want to be careful to keep, yet again, we're not going to disconnect the CBI if we have CBI. We will stop it. We will slide the clamp, but you're going to disconnect the drainage bag. That's where you want to go. Obviously, kind of makes sense. See how this is straight here? If you're trying to get a clot out, you don't want to have to go around these corners. You want a straight shot. So you are going to keep this as sterile as possible. And you can just tuck this here. It's safe. It's in an alcohol wipe. And you're going to want to keep a hand on this, because actually you can just let that sit because it's not touching anything as long as it's kind of just dangling over. And then you are going to want to get all 60 cc's of saline, and you're going to put it in. You want to do this pretty forcefully if you can. Hopefully you can at least get it in. And what you're doing is you're just trying to push that clot. And once you get all the saline in, if you can. If you cannot get the saline in, you go as much as you can, and then you're going to try to pull it back out again. Pull, 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 see if anything happens, and then push. And now it's going in even easier. And now, okay, I'm stuck again. I can't. I'm going to pull, 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 pull. So what you're trying to do is you're trying to loosen up the clot that's in there. Eventually, the goal is to get all of that saline in, and ideally to pull all of it back out again, all 60 cc's. If you are unable to do that, you can try to do it one more time. You can put another 60 in. If you can, and if it opens, sometimes honestly, even just putting it down, sometimes it will start to flow, but typically if you can't do it with the syringe, so you can do it one more time. However, you do not want to obviously keep putting in saline and not getting anything back. You have to stop and let the doctor know that you've tried. You cannot dislodge the clot. So I'm kind of meeting resistance. I'm going to pull back, pull back, pull back. Oh, that's a good, that's actually good. You never want to let go of this catheter. I will be the one to do all these guinea pig things, so you guys don't need to. I'm not dealing with an actual bladder, so that could be part of the reason why I'm not, but you do want to see that you get that back, okay? And if you do not, like I said, you want to let the doctor know. But there is something to be said that sometimes you just have to put as much as you can in, pull back out, push it in, pull it back, like you're working that clot through. And then hopefully if you have had success, you did not have to call the doctor, you were able to get it in, you were able to pull it back out again. A good way, a good trick is to kind of just leave it here to dangle, and you should see output. Just by gravity, you should see something draining out of there. Even if you have to start the CBI up again and see, okay, is something coming out? And obviously if the catheter was plugged and there was a lot in the bladder, there should be something coming out. If not, you just have to keep at this until you are able to get that clot removed. But you know, obviously if you are unsuccessful, it is time to call the doctor and let them come. They might want you to put a new catheter in, they might put a new catheter in. Unfortunately, sometimes really that's all you can do. So just to remember, you always want to keep this as sterile as possible. You don't want that to hit the bed. Just to leave it dangling there is fine. And then whenever you go in to get more saline, you really want to just have the tip go in. Try to keep that tip sterile as you're going back and forth. If you are able to pull a bunch of, you know, whatever, back out again, you can just get rid of it in here. And then you go back, and typically if you can just dislodge that clot, you can keep going in and keep trying to pull more out. You'd be surprised, more clots might come. So if it's still a little sluggish, keep trying to pull it, and if you get a whole syringe full of fluid, it's going to be urine mixed with saline and clots, you're just going to get rid of it, go back, try to pull more out, get rid of it. You could always, if you're getting some out, you could go back and get some more saline, put the saline in. As long as you're able to pull a decent amount out, you can keep putting a little bit more in. So that is pretty much, and then what you're gonna do is once you're done, obviously this, you don't reuse this, you have to get a whole new setup if you're gonna have to do this again. You're just gonna take your little catheter that was wrapped up, the drainage tubing, put that back on. Do not forget to do that. Make sure it's really secure. Dry your patient off, apologize for getting him soaking wet, and then obviously get rid of that. It's gonna be all bloody, and you're going to restart the CBI if you have CBI running. If it's just a catheter, you are going to really need to keep an eye on the output just to make sure that it really is still draining a decent amount. And I believe, and oh, you want to document. So as with the continuous, this is a little different because it's basically saying what the abdomen looked like, why am I doing this, the pre-irrigation bladder scan. So yes, I did do one. There were 600 cc's. This is what it looked like. How many times did I irrigate it? How many mLs did I use? And then after I did it, what did the urine look like? So pretty basic, and that's going to be in your work list. And that is it. And if